Hello, class, and welcome to Child and Adolescent Psychopathology. I am Dr. Levi Armstrong and will be your professor for this course for this fall. I am looking very forward to doing more of these videos moving forward, as well as offering the online optional Zoom classes every Monday, which will also be recorded and uploaded to Moodle. Today, the purpose of this video is just to be a brief kind of introduction of who I am and maybe cover a little bit about the assignments and expectations for the class. This is going to be about a 7-minute video at max. From here on out, I'm going to try to do topic-specific videos as I can and hopefully get those uploaded as well. So first and foremost, just to introduce myself, I am Dr. Levi Armstrong, and I am a clinical and forensic neuropsychologist in private practice. I've been in practice for almost 10 years now, and I've been a full-time graduate professor here in the counseling department at Amberton for almost 10 years as well. And I teach primarily the child and adolescent psychopathology and the adult and geriatric psychopathology courses. In fact, I created these courses about 5 or 6 years ago and have become very passionate in particular about these topics, in as much as about 60 to 70% of my practice is assessments and performing or conducting either neuropsychological evaluations, ADHD evaluations, autism evaluations, learning disability evaluations, and then just general clinical and forensic psychological evaluations. And so I testify in court on this stuff. This is what I read on vacation, as nerdy as that sounds. And in fact, I'm presently trying to kind of outline a book on neurodevelopmental disorders, particularly ADHD and autism and OCD, Tourette's, and bipolar disorder due to their overlap, which we'll talk a lot about in this class. So let's get to the important stuff real quick. Here is your course syllabus. I'm going to zoom in a little bit here on that front. And what you'll see is that for this class, you will need the DSM-5 text revision. It's the lime, not the lime green, the turquoise green or the sea green book, and not the purple one. You will need that for this book, for this class, and that is the only textbook that you will need for this course. All of your quiz questions and exam questions will come from that textbook. And as it relates to what you will be reading each week, as long as you follow along the course outline and calendar in your syllabus, reading each of these sections of the DSM the week before each Monday. So like for next Monday, for example, we are going to talk about neurodevelopmental disorders. So between now and then, I would expect that you have at least had skimmed over the neurodevelopmental disorder section of the DSM-5 TR, and you'll do that each week. So that's what we'll be due each week. Your first week one quiz is going to be due this Friday, and really and truly, that's not a hard deadline, but I'm using it as a deadline so that I can keep track of who is actually in attendance at school or in this class, because I have to send that off to the registrar's office. I will not be dropping anybody if you don't finish your week one quiz by then, but your name might get on a list and the registrar might call you and say, hey, are you sure you still want to be enrolled? They won't drop you either unless you tell them to drop you. So don't worry about that. I just need to know who is attending. And otherwise, the rest of your weekly quizzes are going to be due by the end of the semester. And this says 11/16, which is correct. I'm sorry, that's the right date. But please know that I've got a hard deadline cutoff for all your weekly quizzes. Your midterm exam and your final exam are all due at the same time at the end of the semester, and I do that to give you as much flexibility throughout the semester as I possibly can, because I know that you all have lives outside of this class. At the same time, I recognize that having it all due at the end means that I'm not giving you very much external structure to get through this course, which is true, but welcome to grad school. We are all adults, so I'm going to assume that you are here because you want to learn and that no one's here to push you into learning. My job, as I see it, is to facilitate and help you harness your passion to point you in the right direction in what is pertinent and what isn't. Otherwise, we will be meeting each Monday. And that will be from 7:15 to 8:15. That's optional via Zoom. You will use the same Zoom link embedded here. The link in the meeting ID and the passcode, you'll use the same thing every Monday evening. If you cannot attend, that's completely okay. You don't even have to let me know. I will record those meetings and I will post those just the same way I'm posting this. It'll be through the YouTube link that will also be found in Moodle. So in the meantime, just take a deep breath, and we will be tackling a lot of diagnostic topics this semester, and hopefully help you all feel a little bit more comfortable with not just psychiatric diagnoses, but your overall knowledge base as it relates to making accurate diagnoses for the purpose of treatments and treatment planning and your therapy. So y'all have a great rest of your evening, and we will see you all hopefully next Monday. Take care. Bye-bye.